Okay, I think we can just start. So welcome to today, the second roundtable of the Global E-Conference. This roundtable will be on older people's livelihoods and social protection during COVID and beyond. It's co-organized by the International Longevity Center in Singapore, the ILO HelpAge, and the Confederation of Older Persons Associations in the Philippines. My name is Florian Jürgens. I'll be your host for today. I work for HelpAge International as the Global Social Protection Advisor. I think we have a really exciting panel lined up, and I look forward to all a good conversation. And I think without too much further ado, let's get to the introduction of our panelists. So we have, I think, a really great panel. And I think rather than me introducing yourself, I think it's probably best if you do it. So can I just ask you to introduce yourself very briefly? Maybe we can start in the order of the speakers here in the presentation. So maybe starting with Aura, then Chit, and then Nuno. Over to you.
Hi, good morning, Florian, and good afternoon to at the same time zone. I'm in the Philippines right now. I'm Aura Sevilla. I'm the Advocacy Development Manager of the International Longevity Center Singapore, which is an initiative of SAL Foundation.
I think you're still muted, Chit. Yes.
Sorry.
No worries.
I'm Rosita Lacson. I'm 78 years old. I am the president of Confederation of Older Persons Associations of the Philippines, and we call it CUPAP.
Thanks for joining us. Nuno.
Hello everyone. Seems it's my turn. Good morning for some of you. Good afternoon. I'm really happy to be here joining you in this webinar. My name is, as you see there, my name is Nuno Cunha and I work for the International Labour Organization. I'm based in Bangkok. I backstop some of the technical work we do in the region, providing support for many of the countries in their issues related with pensions, but of course related with social protection in general. I'm really looking forward for this discussion. Thank you.
All right, thanks everybody. Yeah, I think we have a really great panel and I'm really looking forward to the conversation. I don't want to take too much of your time with kind of preliminaries, so let's get right to it. First of all, there will be a Q&A at the end of the webinar, so please, throughout the conversation, put your questions in the Q&A section. So not the chat, but the Q&A section. There's a button that says Q&A. Just plug those in there. I'll keep an eye on them, and then after a conversation between me and the panelists, we'll have an opportunity to put those questions to the panelists. So please do that, and yeah, I hope you'll find the conversation very interesting. Let me give you just a little bit of background to this panel. And I think that's maybe a short kind of setting the scene slide, trying to highlight some of the issues that we're facing, that older people are facing and that we'll be talking about. I think at this point, we're all aware that older people are most at risk from a health perspective. We know that in COVID, we know that the risks of serious illness and mortality does go up with older age. I think that's quite established and well understood. I think where there's less of an understanding and appreciation is, I think, how this health vulnerability or this health risk interacts with some of the socioeconomic challenges that older people have already been facing before, their income security and their well-being. And this, I think, is in a nutshell, is what we'll try to discuss today, this morning. In terms of background, I think it's important to note that there's only 20% of older people in low-income countries have a pension. So the social protection instrument that is supposed to ensure their income security in older age is already lacking and inadequate kind of at the best of times, certainly in the middle of a pandemic. But most older people in low-income countries or already don't have a pension, and if they do, it tends to be quite low. I think it's also an interesting point to reflect on. And point to reflect on is that while we've seen this massive social protection response, and the 1,400 social protection measures that's been taken to protect people from the negative impact of the crisis, only a small section of those relate to pensions at all. Obviously, social protection to older people doesn't have to be just pensions, but I think it's an indication that while older people are at the heart of the crisis from a health perspective, they're not necessarily at the center of the social protection response. Only 8 countries have taken the opportunity to expand pension coverage in this crisis, and I think that's something we want to maybe discuss a little bit about whether can we bump that number a little bit. But I think for me, and what I've learned over the last couple of months really is that I think the crisis has really shown a spotlight at the inadequacy of the current arrangement through which societies ensure older people's income and a dignified life. Since pension coverage is so limited, most older people in low middle income countries rely on family support and informal work. I think we've seen wherever there's evidence where we explore this, that when families are struggling economically, they find it very difficult to support older people. Where economies are, collapsing, where the informal sector is hurting, which is where older people mainly work, the model of income security through older people's own work is under pressure and is no longer functioning. You can argue it was never really functioning because we know that income increases in older age, but it certainly isn't a way to ensure income security for older people during this crisis. Another thing to reflect on is that because of the health vulnerability, older people might be unable to or reluctant to go to the market and work and seek to gain an income. I was recently reading a survey in Pakistan that a few weeks ago, only 8% of older people have left their house, and 70, a large percentage, try to just, shelter and stay indoors. So I think that really makes us ask whether the current mode of income security we have, family support, individual livelihoods and work, are really the way forward during this crisis and beyond. Also, we've seen that older people have been often left out of emergency cash transfers. There are issues with physical access. Older people have high rates of disability. There are also issues with digital literacy and, even like cell phone ownership and access to the internet. That has been challenges for older people to access these rapidly rolled out emergency cash transfers. So as a result, we've seen older people's poverty increase wherever we're looking at it, in most places. And I think in a nutshell, the question is, what can we do about that as social protection policymakers, as older persons activists? What is there anything we can do about it? But before we have a reflection about older people's lives and the policy choices that we could take as societies to protect older people a little bit better, I would love to hear just a little bit more of a kind of a ground truth experience. How are older people experiencing the crisis really? Beyond the statistics, beyond the the kind of the COVID reports. So I would just ask Chit, if you can just give us a short update summary on how are older people doing? How are they coping?
Okay. I am a little bit nervous because this is my first time in international webinar. Personally, it has been very difficult for me. I cannot go out because the government says older people will not allowed to go out and our movement is limited. So older people like me can no longer go out for exercise. We cannot conduct face-to-face meetings or visit our sickly members of our organization. I always worried for me and my family that maybe we will be affected by the COVID-19, the virus. So I constantly move from one place to another. If I hear that somebody is positive in our place, so I will transfer to another place with my child. If someone's turned positive in our community, I am stressed also because my two grandchild lost their jobs. They have no jobs anymore because of the COVID-19, because their office is closed. As to our COPAP members, it's very hard for them because they lost their jobs, they have no livelihood. We have one bedridden member that their child lost their jobs, so they have no more means of, they have no more money to spend for their food. So they have to ask help from their neighbors already. And another member, he is a vegetable vendor. Before the pandemic, he goes to another place, another community. But now, during this pandemic, he cannot sell his vegetable because people don't want to buy his vegetables because maybe his vegetables is infected with COVID-19, and he also is infected with the COVID-19 because he is an older person. So before, this vegetable vendor is not poor. He earned money in selling vegetables from the province and bring it here in Manila. But now during pandemic, he cannot sell vegetables already. Before, when this man have money for their family, but now no more. So no more. The pandemic just made making a living more difficult for many of our members. And since many of them do not have pension or assistance from the government, they ignore the rest of going out, even if they will be contacted with this positive. So they will go out instead of staying home. So they go outside instead of dying from hunger. So during this pandemic, there are so many are very hard in their livelihood because some have lost their jobs. If they apply for social pension, no more slot for this year. So, and also this social amelioration program of the government, some validators have favoritism. So, ano na ba? I don't know how to express anymore.
I think we're understanding what you're saying.
Yes. Okay. That's all for
Thank you so much, Chit. That's been First of all, I think you did a fantastic job highlighting the challenges that other people in the Philippines, but I think in many countries are facing. I mean, I've scribbled so many notes here around the the stigma that other people are exposed to, seen as those who kind of, there's a perception that they do carry the virus. I think the collapse of jobs and livelihoods, both of older people themselves and how they were able to survive. You were saying there were some people who weren't necessarily poor, they were getting by, but now with the crisis, it's all collapsing. But also how families are no longer able to support older people because they are losing their jobs. And I think you mentioned an important point, that the social protection system don't seem to be, for all the efforts that are being done, don't seem to be there to catch people. And what's the point of a social pension if it can't protect people in these difficult times? So thank you so much, Rosita. Chit. This was really insightful.
Thank you.
No, thank you, and we'll get back to you in a little bit. But first, essentially, we take this forward. I think there were a lot of really important elements that Chit has mentioned here, and I was going to hand on to Aura, but she seems to have disappeared. She's back. Well, I mean, I think the question that we wanted to explore is, we hear a lot about older people, but like, are they all the same, or are there differences? Are men and women experiencing the crisis, for instance, differently? And yeah, is there anything you could kind of shed some light at kind of gendered experiences of being an older person during COVID? Over to you, Aura.
Yes, thank you. I'll just ask Nanichi to mute. Okay, thank you for that introduction. So just first and foremost, thank you again for this opportunity to look at the situation of older persons in a gender perspective. So next slide. I just would like to start with highlighting the fact that older persons is not a homogeneous group. Men and women age differently, so that's why the impact of COVID-19 is felt differently by older women and older men. For instance, in terms of the mortality rates or health risk, more older men are affected than older women. In a study recently published in The Lancet, it shows that the mortality rate in select countries, which includes Korea, is that among older persons 60 and above, older males are 55%, and the mortality for older women is only 45%. But despite this, older women bear the brunt of the social and economic risk, which I will highlight in a bit. Next slide. So what are the specific highlights, or what are the specific impact of COVID-19 to older women? First is the increased burden of care. We know that even at older age, older people continue to do child caring, but this time it's not for their children anymore, but to their grandchildren. And since grandchildren are mostly out of school, they are just staying at home. So their parents or the grandparents are the ones taking care of them, while the children try to look for jobs. So they also take care of the sick members, including sick spouse. Among older women, there's still very high population who still take care of their husband who has disability. So this has increased during the pandemic because of the more people are in the house. And then another social impact of COVID-19 to older women is the increase of elder abuse. Even before the pandemic, this issue has been underreported because not many people report abuses that happens within the house. So it's similar to the domestic abuse, but this increased during the pandemic. And one problem about this is even the efforts on domestic and violence abuse only focuses with reproductive age. They don't have much focus with older women who are having experiences abuse, and also with older men who are also not protected by the common violence and violence laws. Another impact of COVID-19 is on the livelihood. This is particularly for older persons in the informal economy. For instance, in Thailand, most of the older women are in informal economy. Most of those working in the still working are in the informal economy. So because like what Nanay Chit has mentioned, if they are street vendor and then they cannot go out or take the risk because of the risk of getting the virus. And this is also not only older persons as affected, but because their children are also affected, as mentioned by Nanay Chit. For instance, data in Thailand shows that 48% of women or of older women depends their income from their children versus 27% of men. So if the children are affected by loss of livelihood, then so are the older women are more affected by this. So it seems like a double whammy because they really wanted to go out to earn a living, but they can't because of the risk of the virus. So, so many older women have to stay at home because of this threat. And last, of course, we saw from the pandemic how the impact of not having a social protection because of the limited coverage of older women who have protection or social protection coverage. This is more specific in their pension or the contributory pension, which I will show next. Next slide, please.
Sorry. Ah.
It's okay. So
Thank you.
as you can see in this graph, this is in general, pension coverage remains low in ASEAN or the Association of Southeast Asian Nations. So, but you will see from the graph that it's much lower among older women. The pension coverage remains low for older women in terms of the coverage. Next slide, please. But aside from having low coverage, one of the issue as well is they have lower pension benefits. For example, this graph from the Philippines is a data from the contributory pension of both older women and men and how much they receive. You can see from the graph that those who have pensions of 1,200 to 1,999 pesos, more women or 44% of women receive this amount versus only 29% of men. And if you will look at the higher bracket, higher pension benefit bracket, there are always less women who are receiving higher pension. So this, so if you have lesser pension, especially now, and you cannot go out, and although relatively speaking, the pension in the Philippines in terms of the contributory pension is really low. Only 30% of older persons in the Philippines have pension or have contributory pension. It's the same number of older women and men, but among women, 50% of those receiving contributory pension are only receiving the survivorship pension. So this is not because of their own entitlements. This is just they had the pension because their husband died. So that's also one thing that they don't have pensions based on entitlement. Next slide is, so this limited access of Social Security among women for us is a result of one, gender bias design of pension schemes, which I would explain a bit. But this is more significantly a result of women's labor force participation due to the care work. First, the gender bias of pension. So most of the private pensions are actually accentuating or highlighting the gender inequality, like still, because these are still the traditional models that relies on single breadwinner. So there's no way to transfer from men to women. Another issue from this is most of the mortality tables are also based on gender, which because women live longer, so of course their pension they receive are also much lower. In some cases, or some pension system also discriminates, like if a widow or receiving survivorship pension, if they remarry, they will not get, or they will be excluded from the program. So we still have those kind of provisions. So there's still a lot of bias in terms of how we design the pension. And another most important issue is that this is a result of the lower labor force among women. We know consistently over the years that although it's been increasing recently, but it remains low. the labor force participation of women are low, and then also women are tend to receive less income, even they do the same job with men. And another issue on this is that women don't have a have interrupted contributions to pension system because they have to take a break from work if they are child rearing. So they don't have a continuous contribution. And one also reason is that also women also tend to withdraw from earlier from labor force because they have to take care of either their grandchildren or their husband who has been sick. So that's the reason why they have fewer contributions, and this accumulate over the years, and that's why at their age or their old age, they have lesser pension than men. So next slide, please. So this is prior the pandemic. This is the situation prior the pandemic. So now comes how the government provides social protection during the pandemic. So some that we saw, the social protection responses to older persons related to COVID-19 are either gender blind or not gender sensitive. Let me just give a sample of the social amelioration program that was mentioned by Nanay Chip. One issue of this is that in the guidelines, it says that it should be the breadwinner, that you have to name the social amelioration program to the breadwinner. So this takes a bit of disadvantage already with older women because there's only one who can receive the pension, and it should be, well, the breadwinner who usually are the men. So another is that even one of the criteria also, or one of the excluding criteria to receive the social amelioration program, if your child have work. So, but since many older women relies to their children, so now if they apply and if the validator know that you have a child who is working as an engineer or working as a teacher, they won't include you. So again, this puts disadvantage to older women. And lastly, it's not age sensitive. Even you are 90 years old or 80 years old, that you have really high risk of getting the virus, you still get through this process. So it's not, even that our data says, the Philippine data says that the COVID-19 is higher among this age group. So it doesn't look at that way. And that's also one thing that we would like to emphasize, that since older people are not homogeneous group, you have to also consider that 60 years old have different needs with 80 years old or 90 years old. But most of the social protection programs only look at this only at 60 years old or 60 plus. Next slide, please. I'm almost done. So this pandemic highlighted the gender inequalities between older women and men, and social protection measures requires gender and life course perspective. So next, because we wanted to address existing and future gender inequalities. So for us, this is what we want. That we had an impression sometimes that gender mainstreaming is just an option. What we'd like to highlight is it should be part and parcel of when we design and implement social protection program. So I think the pandemic gives us an opportunity for more gender responsive and age sensitive social protection. So we can start by enhancing availability and accessibility of gender and age disaggregated data. Then we have to look out if our pension system, we have to design a more gender sensitive pension system. Let's remove the gender bias and discrimination. It might be also good to offer some incentives to women who exit of labor force because of care. Like in some countries, there is such thing as care credits. So we might include this as well. Then lastly, we find that many women organizations are also having women economic empowerment, but only focuses with reproductive age. What we hope is they also include older women on this, and that also the economic stimulus packages of the government also includes older women, particularly those in the informal economy, like giving them digital training so they can sell their products online, those kind of things. Last slide. please. And but also what we'd like to emphasize is, despite these efforts, despite that giving access to decent work to older women and all the structural changes that we have in place, we believe, we agree with this statement that universal pensions, particularly tax finance pensions, are the only means by which most of women, particularly in developing countries, can be guaranteed an income in old age. So this has been one of our advocacy, to have at least a basic income or basic pension for every older women and older men. Next, last slide. Just to share a bit of what our current initiatives at ILC Singapore, we are currently partnering with HelpAge to pilot a project called Pro Older Women Project, which is promoting financial security of older women in Southeast Asia. This focuses mainly on gender and age mainstreaming, and we are trying to build a network wherein women and aging organizations will work together to address the existing and also the previous discriminations that we have mentioned. So because we look at it in a life course perspective, so the better you address the issues while women are younger, then the better outcome it will be for older age. So, and last, we engage at the policy level at both national and regional level. We are currently engaging with the ASEAN Secretariat for to include gender and aging in their policy. So for more information, our website is here and email, and we hope that to collaborate with some of the groups that would like also to showcase or to highlight the issues of older women and address it. Thank you.
Thank you so much, Aura. What a great kind of whistle-stop tour through, you know, the challenges that older women are facing in this crisis. And I think it's such a clear, to me, example of how a system just isn't designed for them. You know, it's just like at every turn of the you know, at every kind of stage of the life course, there's, you know, discrimination, inequities, be it the labor market, be it even the pension system. It's just the status quo just it's clearly isn't working. It isn't working to ensure income security for all the women. It isn't working to enable, you know, kind of economic participation and you know, kind of for women throughout the life course. So there is clearly a need to do something differently. I think just kind of continuing as we have just cannot be the answer. Seeing how, you know, reflecting both the points that you've made and Chit, how older people are struggling in this crisis in particular, but in a way this crisis just kind of heightens existing issues that were already there. You know, the older people were, and older women in particular, were already struggling with similar issues before. So I guess the question is then, you know, what can we do about any of this? You know, there's a lot of talk about doing things differently, building back better, taking this crisis as an opportunity to do something differently about the way we organize society. Is this a wake-up call for us to approach income security differently, or to prioritize it more? I don't know. Over to you. Nuno has the difficult task now to tell us what needs to happen, and yeah, just reflect a little bit on how we can ensure income security for older people, how we can kind of enhance their well-being. I know I'm setting you up now for quite a lot, so good luck, and yeah, we look forward to hearing from you. Over to you, Nuno.
Thank you, Florian. It's indeed not an easy task. First because you ask a big question, what can we do better and how can we build better in the future? But also because, I mean, many of the ideas I had in mind were somehow already brought by our colleagues in very good presentations. Could you move to the next slide, please? I mean, my first point, and even before kind of answering to the question, what should we do? I think it's important to think a little bit what really pension schemes and pension systems, what are their role in the societies? And we tend to think and associate those only with the person, the recipient of the pension, but we need to think that this is a benefit that in the end goes to an household. And this means that in one side, it's especially in crisis, and we saw Rosita mentioning about the grandchildren or the children losing their jobs. And we know historically that in many societies, during financial crisis, during employment crisis, it was sometimes the only income that was still coming to the household. Means that many times was the pension that was the only source of income to the full family, including to the adults and including to the children. And this happened, for instance, in my own country during the last public crisis, public debt crisis, where there was, of course, a big contraction in economy. And there were families where both adults were not able to work. And that was the thing that kept the family alive, that keeps allowing them to satisfy at least a minimum level of needs, especially when unemployment insurance period was over, social assistance was not enough because the government had limitations, and the pension that was a right acquired before was still there to help and was extremely important. At the same time, it's also essential as a tool to ensure that we avoid what we call the sandwich generation, and especially these in a moment where, particularly in the region where we work, we know that lots of countries are going through a process of aging, with fertility rates going down, with the families being smaller these days. Means that many times families and the working adults are those who have to take care, in the absence of pensions, as you mentioned, they have to take care many times of financially to be responsible for their children and very expensive education, but also the elderly. What creates a situation that is for sure not the best. And I think this is really important that we have in mind. Pension is not only about the elderly, it's about families. And that's very important. Next slide, please. The second point is about the automatic stabilizer effect that pensions had. I mentioned this somehow in the introduction, but when we have then the economies suddenly all slowing down, and you know that people are not spending because basically they are losing their jobs. They are also being more careful because they are not aware of the next day, and the economy is suffering like it's a cycle. No, it's less, the demand is going down. Businesses, in particular small businesses, are suffering even more. And again, if you have already a pension system or a social protection system of any nature, like unemployment insurance, you are sure that there are tools that make this answer to be automatic, that are boosting the economy and bringing money back to the economy in a moment where there is a contraction. And this is very important, and we saw several studies from some of our partners and even us. We did some analysis on the multiplier effect of social protection and the impact that $1 that comes through a pension or through an employment insurance, the impact that this has in the economy, in the local economy. And we know that most of the elderly will spend the money locally. They will help boosting the seller of vegetables that we were talking before. And this I think it's another important element, is to see pensions in the big picture, especially in a moment of crisis. I think it's an important element. But even beyond crisis, we saw, for instance, the impact. We are doing currently a study that looks at countries like Korea, Japan, where they have robust systems. The impact of $1 going through social protection is higher, especially through consumption, that is $1 spent in some other areas, meaning that it kind of challenges a little bit the idea that social protection is a cost, versus seeing it more as an integrated element of social and economic policies. Next slide, please. But of course, I mean, it's not easy if we want to have the sort of impact I'm talking, not only impact for people. I mean, ensuring that people have the proper protection that it should be, and they can satisfy their basic needs, and they keep, I think, of course, that's the essential one. But even if we want to go beyond, and if we want to talk about having an impact in the economy, supporting the family, we need, of course, wide coverage. And this is not the case, I mean, in many countries in the region. I mean, we know the average, for instance, the average is still showing us that 45% of people don't have access to pensions. But this average hides big differences between countries, because we have countries with 100% coverage, and then we have countries with less than 10%, but many countries go around the 30 to 20%, and then it's hard to get, and especially during crises like this, it's very hard. And we saw the challenge of putting in place new systems, of extending coverage, versus the countries who are able to use systems already in place. The second issue is ensuring that benefits are adequate. I mean, we know that this is a big problem. We often underline countries, many of the countries who are good examples with universal pensions, but when we look at the adequacy of benefits, they very often don't meet the basic, don't meet requirements to satisfy basic needs, meaning that they lose their importance. And I give you an example. I mean, Thailand, when they took a very important measure of creating a subsidy for informal sector workers during 3 months as an answer to the impact of COVID, and it was 5,000 baht. At the same time, the social pension is between 600 baht and 1,000. If the government decided that the minimum amount for a decent transfer was 5,000, I mean, how can we measure this against the 600 or 1,000? And even if then they finally increase those with 600 to 1,000, that's probably showing that there is a gap and there is an issue in the adequacy of benefits. And Thailand is a good example. I mean, it's still among the countries who have a system, who actually took several measures, but shows that even there, I mean, we need to discuss the issue of adequacy of benefits. Adequacy of benefits is then also related with the extension of the contributory pensions, because we know when we assess the role of social pensions that usually there are flat pensions, and even when they meet the basic needs of some of the most vulnerable, they don't really play the role of income smoothing, of replacement of earnings that should play the contributory side. And more, if we look to the region, is this kind of combination of systems. If we look at successful stories, is the combination of systems who really allow countries to reach both of these objectives. Yeah, next slide, please. Still in terms of the crisis, I mean, there are elements that we are often maybe paying less attention, but we need really to ensure that the funds that are the pension funds, people contributed with an objective and the promise of getting something in the future, they need to be protected. And we see plenty of countries this discussion. In some countries, the use of provident funds, but even in some countries, you find a discussion on, can people have access to their funds, even in social insurance mechanisms, meaning that people are using this to a loan as a collateral. And we know that people, of course, we have many times we look to the short-term needs, immediate needs. That's normal, but that's the role of the government to ensure that this is not possible, because we are solving one problem today and we are creating a massive problem in the future, especially in countries that are aging, that families are being smaller. If we kind of put at risk now because of the crisis, the situation of these funds, we might be in a position where we will have to have a massive intervention from the government in the future to deal with this, to deal with the fact that people might have less contributory pensions in the future what they have now, where we need to do an effort to go in the opposite direction. And of course, the same applies to provident funds. Next slide. And I mean, this is just a mesh. We do really believe that right now and even more in the future, I mean, social protection will occupy a special place, an important place, more than emergency measures that are now kind of some of them coming to an end. But we need to think on really the role that it will play. It will play in maybe even a new transformed economic and social model, relying more probably in domestic demand. We saw the limitations and the challenges that we probably will face for some years in terms of international demand in areas like tourism or even manufacturing that is associated with exports with all the global crises. And this is also important to think what will be the role of pensions and social protection in these new models. Next slide, please. And I think I'm coming, yeah. Yep. What can we learn? I'm coming to the end. I really need to, I was trying to go slow, but now need to speed up a little bit. What can we learn from the past? I think we always learn. Can we move to the next slide? I mean, what we saw is that usually, and especially countries in this region tend to use the crisis as opportunities, tend to come stronger and stronger also in terms of social protection. I mean, we saw that many countries, they extended pensions, they make pensions universal. They after the big crisis we saw like 1997, 2008, and we need to think that, I mean, maybe it's the time to reflect, and maybe it's an opportunity to push for some of the elements in the agenda that my colleagues mentioned before. Yep. Yeah, I think, yeah, we need to ensure that, I mean, we have a better normal, and this better normal is for everyone and not just for some. Thank you. Thank you very much.
Thank you very much, Nunu. I think I'm glad I've ended on this slide, is my favorite. Thanks for your very, very insightful presentations. I think one thing I'm thinking about more and more is this whole idea of systems needing to be in place, and that countries that have more comprehensive systems in place are have been better at responding to this crisis, because there was less of a need to implement kind of ad hoc emergency measures, but they also had tried and tested systems in place to reach people. And I think since this is probably not going to be the last pandemic, I think there's a real value in investing much more in comprehensive programs and systems which can provide that role of kind of automatic stabilizers, kind of supporting the economy when there's downturns, but also providing a more effective, I don't want to use the word safety net, but an effective protection of people for when things go wrong. So I think this is for me certainly something that I would like to see coming out of this crisis, is that just a greater appreciation of social protection in terms of how it can protect people in these kind of downturns. But I think maybe a little bit more interestingly, I wanted to close by coming back to Chit. As an older person, I think you gave us such a insightful and very vivid kind of picture of what it means to be, to some extent, at the kind of receiving end of this crisis. Kind of bearing the brunt, as older people. There's a lot of talk about, a better world that can, if we put our minds to it and if we work, we can emerge out of this crisis. And I would just, as a closing point, before we go to a Q&A session, and please, participants, put your questions in the chat box or in the Q&A box. But first, Rosita, Chit.
Okay. Thank you.
How can a better world look like?
Maybe I wish to see our government here in the Philippines, that the government will prioritize the welfare of the older people, because this pandemic showed us very difficult and short the life of an older people. I wish that there will be a universal social pension in the country, which will eliminate favoritism from the validators and disputes among the members of the organization. I wish older people will get a decent pension that will give them peace of mind and will not make them dependent of their children. I wish to live in a world where older people are treated fairly and with dignity. Finally, I wish to witness this in my lifetime and not when I have gone. I'm also calling for the support of the younger generation, because they will be older next time, and what we are doing now is not for older people now, it's for the next generation. Thank you.
Thank you so much. I think this is a really great way, closing statement almost. And I think I really like your call. And I think that's what I certainly feel as well, working for HelpAge, working for older people, that on the one hand, it's about, those who are currently, older and need, support and need pensions, as we all do. But I think it's about building more inclusive and just societies where those in need of support can get it, and where social protection is a right. I mean, it is where that right is realized. So we have 10 minutes left for maybe some questions. But attendees, I'm not seeing any in the chat box, but please do post your questions in there. We have these three great, speakers. I'm sure you have something you would like to ask them. So please do put your questions in the chat box. I'm not seeing any at the moment. Maybe, yeah, I don't know. Does any of the speakers have a question to any of the other speakers? Maybe then I can just ask a question that I have in mind, and maybe I can direct it to Nuno as we wait for other questions. Are you optimistic? I think, a lot of countries are going to face some pretty significant challenges, raising revenue. There will be pressure maybe after this initial phase of social protection expansion, these like measures. Are you optimistic that we'll be able to transition to a social protection system that is a little bit more inclusive and invests more and sees social protection as an investment? And maybe what might be the kind of the context criteria for that positive development to happen? So is there what can maybe we do as a society or as partners? Yeah, are you hopeful?
Thank you. It's I mean, not at all easy, no crystal ball here to know, but I mean, if personally, I mean, if we look at crises, I mean, and crises were hard in the past. I mean, there was, as I mentioned, I think in terms of social protection, there was indeed an increase. I mean, I think there is a recognition from those at a very high level positions who probably were not, I mean, so it was not so clear for them the role of social protection, the understanding of social protection, the understanding of the size of people who are unprotected, those who are in the informal sector many times were invisible for those policymakers. I think there is clearly a movement, more interest right now. We saw the speeches, for instance, in the Global Summit on the world of work. I mean, we saw, I mean, from employers to workers to the different governments to even all the international organizations were putting the point on the need for social protection, on the need to cover those in the informal economy. I think there is an opportunity. At the same time, as you mentioned, I mean, it depends also. I mean, we really don't know how the crisis will evolve, and I think that's the big question mark. How much, I mean, we can, up to which point countries can really still have the financial resources, even globally, to deal with it, and with increasing, it's kind of a coin with two sides. In one side, the longer the crisis will take, the more needs will exist. At the same time, if the crisis is extended, there will be a challenge in terms of resources. I mean, it's but that we don't have. I don't have an answer. I mean, it's really, I think, a big question mark. But we need anyway to be constructive in that regard. I mean, to try to find solutions instead of seeing ourselves as defeated. Otherwise, our job will not be really very helpful.
Yes.
I hope I answered.
No, you did. I think, and it's a tricky question. I think we have some great questions that have come into the Q&A. We have 5 more minutes, so let's try to answer those. There's a really nice one here that I think will work well for Aura, from Supriti. What would you say is the single most important factor that you want to be included in social protection policies for them to be both age and gender sensitive? You know, if you're in charge, what's the most important thing that you would change to make things better for, well, make it more age and gender sensitive?
Yeah, I have two actually. But I think one important is having to consider care work, because this is not, the care work is not really considered as, and this unpaid care work is not considered as, aside from, they are not really, women, particularly women, are doing a lot of unpaid care work. And this also do not translate to our social protection system. So it should be that there should be higher, when like care incentives, or care incentives should be added, or when people are exit the labor force to take care. So I think that should be included as care credits. Um, and because we know that when they get older, they get, this could be accumulated. Uh, and this is also one way, like social pensions, this is also one way to pay the older people with the unpaid care work that they've done over the past. So I think this is one thing that we should include. And maybe just a slight institutional one, if we put more women in the boards of those who are also like working, the board of like private contributory pensions. So if we if we at least nominate at least, if of all the board members, at least one or two women would be there, then that would, I hope, would give a gender lens to the issue as well, to designing and implementing social protection policies.
Those are, I think, two fantastic points. I think care is such a big issue, just in terms of how it affects, people's life course and their opportunities to be economically active, particularly of women. I saw a very depressing statistics, I think, out of the US recently, that I think, I don't know the time frame, but about 1 million people have dropped out of the labor force over the last month, and I think 800,000 of those are women. It doesn't have to be just related to care, but I would imagine that's a big part of the answer. We have few more minutes. I have another question here about the experience of older people with disabilities. And I was wondering, Chit, in your organization, COPUB, do you work with older people with disabilities, and how are they experiencing the crisis?
We also take care of our PWDs, we call it person with disabilities. If they are bedridden, we will go to their house to help them. Sometimes we'll bring food and we will take a bath, we will clean him and change their clothes like that and their beddings, because the wife of the bedridden is also an older person, so he cannot attend very much to her husband, and sometimes her husband will punch her, so she do not like to go near the bedridden, because I don't know how to.
It's difficult work. I think that's something to recognize, that care is hard work.
Yes.
Right. So we are, I think, a minute away from, I think, just getting kicked out of this unceremoniously out of this Zoom call. So I just want to make sure I thank all of you for this great panel. I think I've learned a lot. I had a really good time. I hope participants found it insightful as well. Chit, Nunu, Aura, thanks so much for joining. Thank you for your very interesting, I think, really, really kind of evocative presentations. So I hope you're all well, and hope you all stay safe, and keep up with the good fight, and we'll be in touch.